guys, it's me, Professor D, and welcome back to my channel. If you haven't done so already, please be sure to like, comment, and subscribe below. This video is going to be very short. I'm just going to be going over my 11 key points for passing the NCLEX, okay? So before I even begin, you must know the core content, okay? So you can't just use these tricks and not know the information. You have to know the core content. However, many students can know the book from their textbook from beginning to end, but they don't know how to answer their questions and they still fail. So aside from knowing the content, which you have to, I'm going to go over these 11 key points, okay? So my first key point, look for repeated words. If you see there's a certain word in the stem of the question, and then you also see that word in an answer choice, and if you have no idea what the answer is, choose that same choice that you saw that same word in the stem of the question. So for example, if you get a question that says, you know, the patient's blood pressure is decreasing, their H&H is decreasing, the heart rate's going up, you're suspecting that the patient's bleeding out somewhere, what are you going to do? And they give you 4 choices. And one of those choices is to look at their stool for occult blood, that's hidden blood, right? That's going to be your answer, because in the question, in the stem of the question, you saw that you were looking for a patient hemorrhaging. What does that mean when a patient's hemorrhaging? That means they're doing what? Bleeding out. And in the answer choice, you saw to look for what? Hidden blood, occult blood. So that's a perfect example of what I mean, okay? Next one, look for opposites. If you're looking, you get a question and you're looking at your answer choices and you have no idea what the answer is, but then you see 2 opposites. So for example, you see increase infusion rate or decrease infusion rate. Choose one of those as the answer. So I'll give you a perfect example. You know, a patient's supposed to be getting normal saline, 125 milliliters an hour. You come back 45 minutes later and you notice that that patient's been getting too much of the normal saline. What do you do? And 2 of the choices was increase or decrease. Hopefully you chose decreased infusion because the patient was getting it too fast. You don't want to throw them in overload. But the point is you saw 2 opposites. When it's a multiple choice question and you see 2 opposites, if you don't know what the answer is, choose one of those opposites, okay? Most of the time, when there are 2 opposites, one of those opposites is the answer. Now, come on, guys. If you know that you know that you know your correct answer is not any of those 2 opposites, obviously don't choose it. I'm talking about if you don't know what that answer is, choose an opposite. All right, next tip, odd man wins. So if you guys get a question and in your answer choices, 3 of your choices have something in common, right? And 1 of your choices have nothing in common, choose the one that's the odd man out, the one that has nothing in common. So a perfect example, you have a patient on the psych unit and they become violent. They're throwing things. What are you going to do? Are you going to ask them to calm down? Are you going to ask them about their feelings? Are you going to try to distract them, or are you going to remove that patient? Let me give you that same example, same choices, except removing the patient. Are you going to remove everybody else from safety? And the correct answer, you're going to move everybody else from safety. I want you to look at the choices I gave you. Choice 1 was talking to the patient and asking them to calm down. Choice 2 was asking them about their feelings. Choice 3, distracting them. All of those choices have something in common. That patient is still going to be there throwing things, right? But choice 4, right? For choice 4, when you remove everybody, you're removing everyone from safety. Where that patient's throwing things, they have no one to throw things to. Does that make sense? Now I want to point something out to you. This has nothing to do with my tips, but I just want to point it out since we're on that subject. When it comes to psych, if a patient is being aggressive, but they're not throwing things, they're just being aggressive, you're seeing those symptoms of that patient having the potential of being aggressive, such as they're pacing, their hands are clenched, they look mean, right? Then you're going to escort the patient out. But if the patient is actively throwing things, they're being actively violent, you're going to get everybody else out of harm's way. Okay, so know the difference. If the patient's not actively throwing things, they're just showing the symptoms of them escalating, then you're going to remove the patient. But if the patient is actively being violent, being violent, actively throwing things, then you're actually going to get everybody else away from safety. Why? Because if they're throwing things, you think you're going to be able to get that patient out the room. No, whatever they're throwing, they're going to be swinging at you as well, right? So at that point, you're going to get everybody else to safety. Versus if you see them increasing in their behavior, you see their behavior escalating, that's when you'd actually get the patient out, okay? So that's what I mean when I say odd man out. If you see 3 choices that have something in common, choose the answer choice that does not have something in common. That's your odd man out. Next one, umbrella answers. I always teach my student that. Look for umbrella answers, okay? An umbrella covers you, it protects you, right? An umbrella answer is something that covers all your other choices, all your other correct choices. So a perfect example of that is, you know, a patient comes, presses a call bell, you come in the room, the patient says they're not feeling well, you see them sweating, what are you going to do? And you have an answer choice of take their blood pressure, and then you have another choice of take their vital signs. Well, vital signs is an umbrella answer because guess what? It includes taking the blood pressure, but it also includes taking their respiration, taking their heart rate, taking their temperature. So that's what I mean when I say choose umbrella answers. You like that, those, when you have a multiple choice and you see an umbrella answer, an answer that includes your correct answers, that's the choice that you're going to pick. All right, next one, absolutes. Stay away from absolutes, okay? Nothing is absolute in nursing. You want to give yourself some wiggle room. So those answer choices that say always, never, only, do not pick that answer unless you know that you know that you know that you know that's the answer. And 99.9% of the time, that is never the answer, okay? You want those answers that give you the wiggle room, such as sometimes, such as normally, such as potentially, and you'll see the list, okay? Those are the answers that you want to go with. Next, time frame. If the test writer goes to the trouble for including a time frame, then this information has been put there to help you select the correct answer, okay? And let me give you an example of this. You get a question that says, the patient just came down from surgery 20 minutes ago. What are you going to be assessing them for? Well, let me tell you, there's a difference of what you're going to be assessing for if the patient came down 20 minutes ago versus that patient being post-op 2 days. Let me explain how. WBC's infection. Remember on my, I don't remember which video, but one of my videos, actually on my priority videos, I taught you that any patient that's post-op, we have 3 priority things that we're watching out for. We're watching out for hemorrhaging. We're watching out for that patient developing a DVT or a pulmonary embolism, and we're watching out for infection, right? So this patient just came from surgery. If they just came from surgery 20 minutes ago, are we really looking for infection? No. It's too soon for that patient to develop an infection. It's too soon to see those WBCs go up, right? But 2 days post-op, oh yes. Now, you know, the patient's had enough time for those WBCs to go up for us to see those signs and symptoms of infection for that patient to have actually developed an infection, right? But 20 minutes post-op, so soon. What are we expecting? Well, not what we're expecting, but what are we looking out for? Hemorrhaging, right? That patient just came from surgery. We're watching out for that patient bleeding out. So that's what I mean when you see a time frame. When you see them give you a time frame, pay attention to that. That time frame is to help you choose the correct answer. All right, next one, priority questions. What would you do first? Guys, nursing students, you guys hate these priority questions. If you have not done so already, please watch my video on priorities. I make it very clear, very simple, which patients are a priority and what your priority interventions are. So when it comes to the priority questions, what would you do first? This is very important, guys. When you're taking NCLEX, you only have one chance for each question to tell NCLEX that you know what you're doing. So when you have a question that says, what would you do first? You need to say to yourself, What answer am I going to choose that I'm letting NCLEX know that I'm going to do this no matter what? Okay? That's what they mean when they say, what would you do first? NCLEX wants to know, do you know what you better do no matter what? Because you're going to get 4 right answers. You're going to want to do all of these for your patients. But what's going to be a priority? You better say to yourself, what do I want NCLEX to know that I know, regardless of what's going on, I'm going to make sure I take care of this, okay? Make sure you guys watch my priority video if you have not done so already. Next one, a question will not be a question on NCLEX unless there's something wrong with the client. Guys, I promise you, if you listen to anything Professor D tells you, you better listen to this. Do not ever choose an answer that says continue to monitor. You hear me? That may be an answer on one of your test questions in school, but it's not going to be an answer on NCLEX. Let me explain something to you. One test question on NCLEX, hundreds of man hours and thousands of dollars go into creating that one question. So you better bet your bottom dollar NCLEX is not going to waste a question when nothing's wrong with that patient. I guarantee you, okay? So when you get a question, do not choose continue to monitor. Oh no, honey, you're going to be doing something. You're either going to be assessing, you're going to be doing an intervention, but you will be doing something, okay? So you need to say to yourself, what is the worst case scenario? All right? Because NCLEX is always worst case scenario. It's never, oh, everything's right with the patient. NCLEX wants you to think like a prudent nurse, okay? And this is what I tell my students. A prudent nurse is that nurse that nobody else wants to work with on the floor because they're annoying, okay? That nurse is worrying about their patients, worrying about your patients, worrying about your coworkers' patients. They're worried about everything. Everything's a big deal to them. That's who NCLEX wants you to be. NCLEX wants you to be that nurse that everything is a big deal, okay? All right, so that's that. Next one, if there's something you can do to fix the problem or help, do it first before calling the doctor. I want you to think about it this way, guys. Before you turn your back to call the doctor, look to see if there's something that you can do. So before you choose that answer, call the doctor, because sometimes there is nothing that you can do to help that patient. The only thing you can do is call the doctor, right? Because you may need orders. However, most of the time there's something you can do. So let me give you an example. You walk into the room, patient's having difficulty breathing. You look at that O2 sat. That O2 sat says 82. And the clinical picture of that patient, yes, you see that patient can't breathe. Okay, what are you going to do? Well, before you call that doctor for orders, guess what? Something simple you can do is sit the patient up. Why? When you sit the patient up, that decreases the pressure that the diaphragm has against the lungs, right? So that the diaphragm goes back down, the lungs are able to expand more. And just by that patient sitting up, you got that O2 sat to go up a couple points. You help that patient to breathe a little bit better, okay? How about you adjust their oxygen? Maybe they don't have their oxygen on and you have to put the oxygen back on them. Yeah, you're still going to call the doctor, but guess what? That's something you can do. So before you choose that answer of call the doctor, look at your other choices and say to yourself, can I do any of these for my patient to help them or fix the problem before I call the doctor? Okay? Because you can't say, oh, well, I was going to do this, but calling the doctor first, I wanted to call the doctor first. Well, no, you had only one choice to choose for NCLEX. And NCLEX is looking at you like, oh, so you're just going to turn your back, call the doctor, and you're going to let that patient not be able to breathe when you could have just sat them up and helped them breathe before you call the doctor? You're not ready for your license. So look at those choices and ask yourself, what can I do for this patient before I call the doctor? Another example. So here's an example. The nurse is caring for a 30-week prima gravida who's receiving magnesium sulfate IV for premature contractions. The nurse is monitoring hourly urine output. The first hour, urine output's 180 mLs. The next hour, urine output has decreased to 140 mLs. Based on this data, which action should take priority? 1, notifying the physician. 2, stopping the infusion. 3, decreasing the infusion, or 4, reassessing the urine output in 15 minutes. So let's think about this, guys. We know that magnesium sulfate does what? It relaxes smooth muscle. The uterus is a smooth muscle, it relaxes the uterus, but it also relaxes all other smooth muscles. So we know urine output should be at least 30 mLs per hour. Patient started great, 180, then it went down 140, okay? Remember what I told you guys, if you're taking NCLEX, you're looking at a question, something's wrong. You see that number 4 where it says reassess urine in 15 minutes? That's another way of saying continue to monitor. So you get rid of that automatically. Something's wrong. You're going to do something. We get rid of that. So now you're down to calling the doctor, stopping the infusion, decreasing the infusion. Number 3, decreasing the infusion. You're telling NCLEX, well, I realize something's wrong. I'm just going to kill them a little bit slower. I'm just going to let them die a little bit slower. So you're not going to decrease the infusion. You're between calling the doctor and stopping the infusion. You're going to stop the infusion. That's the answer. You stop what's offending that patient. You stop the infusion, then you can call the doctor. But you always do what's going to help or fix the problem first. You stop that infusion, then you call the doctor. And I know what some of you students are saying. Well, Professor D, you just said the norm is at least 30 mLs an hour. Correct. But you see those numbers creeping down. Urine output goes down. What does that mean? The kidneys are in trouble. And remember in my priority video, I explained to you how important the kidneys are in telling you what's going on with the patient. Because as soon as that patient's severely ill, what happens? Those kidneys shut down. You see BUN and creatinine going up, and you see urine output doing what? Going down. And that's exactly what's happening in this picture. So are you going to wait until that patient hits 30 to call the doctor? No, by the time the doctor gets there, you're able to get orders, that patient will be dead. Okay? So as you see it creeping down, you're going to do something about it immediately. You're going to stop the infusion, then call the doctor. Okay? All right, my next tip. If it's a choice on NCLEX, you have an order, okay? It sounds simple, but I can't even tell you how many students get questions wrong because they don't realize this. Guys, if it's a choice, that means you have an order for it. Don't ever think to yourself, oh, I don't have an order, so that can't be my answer. No. If it's a choice, that means you have an order for it, okay? And my very last tip, never ask yourself, what if? I say this to my students. You are not Daniel Steele. You're not a writer. You're not an author. Stop writing your own story, okay? Don't say to yourself, what if? Whenever you catch yourself saying, what if, bring yourself back and look at the question. Because the way these questions are designed, you have enough information to answer the question. You don't have to ask yourself, what if? And if you do have to ask yourself, what if, you're choosing the wrong answer. Go back to what is given to you and choose your answer accordingly. Guys, I hope these tips were helpful to you. Please, very important, if you haven't watched my priorities video before, make sure you do that. You'll find it very helpful. Again, if you haven't done so already, please don't forget to like, comment, and subscribe below. Thank you for joining me, and I'll see you guys next time.